On to this now. The National HealthCare Group, in collaboration with Stellenbosch University and Alexander Forbes, have introduced a pilot project called MediClub Student Connect. Now, this platform is an online interactive system which provides students access to doctors and prescribed medication via WhatsApp, among other services. To tell us a bit more about it, let's bring in the Executive Chair of the National HealthCare Group. That's Dr. Reinda Nota, who joins us via our video link this morning. Doc, it's great to see you. Thanks very much indeed for making time. This kind of consultation that can take place on WhatsApp is quite innovative, and of course there are many other ways to put it, but it's still at a pilot phase, focusing specifically on NSFAS students. Tell us why.
Yes, I think just before I get there, a brief background, because we've been doing this successfully in a broader perspective, partnership with two major banks already. The focus on students is obviously they are a very specific target. They live in one place most of the year, namely at the campuses, and we've started this at Stellenbosch University. But what it basically boils down to is that student and anybody else, in fact, that joins us gets a WhatsApp number that they literally use and WhatsApp in case of illness. The WhatsApp initially is a typical WhatsApp bot, so it'll answer you back, welcome to the nurse or the doctor, and then it makes you answer a few questions until you have your we've been made sure that you are part of the subscriber base. And then a real doctor or a nurse will actually phone you on whichever line or mode of communication is available to you, either the normal telephone or WhatsApp or via an internet chat box or whatever. That consultation then leads to a specific conclusion, either that you must go and find yourself a few Panados, or you are ill enough to be referred to the local campus doctor, or in fact any other GP on our network. And there are roughly 3,000 of them all over South Africa. So from this you can deduct that when students are on holiday, they're not left in the lurch either. They can just follow the same process. And when our doctor on the WhatsApp call number sees that you need a real face-to-face doctor consultation, you are then sent to your nearest national healthcare doctor. And as I said, there are thousands of them, just over 3,000 scattered all over South Africa. And they will then see you and also have the ability to prescribe medication, all of that included in the price. So the students are never out of pocket as long as they follow very simple rules. And this product has been offered to lower income students, and it will shortly be opening to all students.
Sure. And of course something necessitated this kind of project, right? I'm sure you've done some kind of evaluation around how easily healthcare services can be accessed for students in particular. But what are some of the problems that you're hoping this will be able to solve? In a context where we've heard in the past, for instance, that students sometimes really struggle with things like mental health and don't know how to go about addressing some of those challenges.
Yeah, I think the main issue is just access to a GP. Many students are on their parents' medical aids, but more and more are on no cover. And the campus doctors alone are often not sufficient. And if they are, they also, would typically have a fee. So it is a system that allows a student to go nationally wherever they are. Some campuses have satellites. And it's a wonderful younger population that needs access to a doctor. And this is by far the most cost-effective way.
Yeah. From the work you've been able to do, have you been able to ascertain how willing to come forward, for lack of a better term, students are when they have struggles with their health, broadly speaking? I mean, typically this is at the prime of your youth, they say. Many students spend much of their time having fun. I wonder how much of tension you reckon there is on addressing issues to do with health in that space.
Look, at least the student has no excuse not to be able to contact a doctor. There's no cost involved. He does it so without anyone having to know that he's doing so on WhatsApp. And obviously once he's in the system, a very confidential normal doctor-patient situation is created. So, I don't think students, there are obviously the cases where sick notes are needed just prior to exams, and those are the pressure points that the campus doctors are aware of and are being dealt with very appropriately. What's nice about the model is that it's clearly not having to be limited to students, and we have already several thousand of other people. One big partnership is a very similar model with a time bank that was launched about a few months ago. Another big bank is involved because this model is really a form of privatized NHI. And we know that NHI is urgently needed, but it's not that easy to set up. And the doctors that we have rounded up in our network are very positive about the future and are helping to create, at least at primary care level, a fantastic solution that is affordable and that could at least be a precursor to hopefully what will one day be done by government.
Yeah.
So it's proactive and it's something that is dearly needed.
Are all the doctors who are part of this initiative in the private sector?
Yes. Now, this is completely a private sector initiative. The idea is to take out of the long queues at government, bring them back into private at a price point that companies and students and their parents can afford. So it's really a fantastic initiative, and the name National HealthCare tells you that we're trying to really do this without having to increase in any form or fashion the burden currently on the state sector.
All right, Dr. Nota, thanks very much indeed for helping us better understand this initiative. Hopefully, it'll go a long way in trying to solve some of the really long-standing issues we do have in our healthcare system in this country. The Executive Chair of the National HealthCare Group, Dr. Nota, thanks very much indeed.